Good morning. I've just put my timer on because I've got a lot to say in a short time. This is very exciting and I'm delighted to be here. Thanks everybody for coming. Joe and I are sharing the future of digital health in dermatology, and I'm sure we'll have different and overlapping aspects to fly through. Wonderful to have AI to help us write our presentations. I'm a dermatologist in Hamilton in New Zealand. I plan to talk about digital health in terms of patient care, research, and education. Digital health in dermatology covers lots of things, including teledermatology and many others as listed here. I'm going to talk about a few of those in communications technology, teledermatology, imaging, AI diagnostics, large language models, ethical challenges, and education, some of which have already been covered, and I really enjoyed the students' presentations this morning. So what we can say is everything's speeding up, and we're tripping over ourselves to keep up with technology and communications. But it's a fast train, and if you don't jump on it, you're going to get left behind. So I thought I'd talk about patient portals to start with, because we should remember that the patient is the center of everything we do. And those portals allow patients to be engaged. We can educate them, message them, provide telemedicine, and even prescribe through the portals. This is what my portal looks like. This is called Manage My Health, and is the New Zealand government's response managed by the different GP organisations in New Zealand. So what's happening with the internet? So the internet is becoming more available wherever you live in the world, but it remains expensive to those in developing places or remote areas. So it's scary how much energy data centers use. To train a large AI model can equal the consumption of an average household over 291 years, greater than some countries. And if we don't do something about it, we can expect the energy consumption to become much greater over the next 5 years. Luckily, the big companies like Google, Amazon, and Microsoft are attempting to find renewable energy and energy efficient technologies. And the green line is what we're hoping for, slight increase rather than huge. Teledermatology is widely available throughout the world. We expect to integrate AI for diagnostic support if you're not already doing so. However, we still have the problem that not all populations can access a dermatologist, even via a telemedical platform. We have live video and store and forward teledermatology for medical purposes, cosmetic, surgical, wound care, pathology, and education. So teledermatology has been shown to reduce the carbon footprint. Look at that moving graph on the right. It's pretty scary, really, to see how much global warming is happening. And we want to not to use reusable cups, which I see everywhere, and think about whether we should be jumping in aeroplanes, as most of us have done to get here. The wonder of e-prescribing. This is our e-prescribing system that we use at Waikato Hospital and has been available to us since 2021. It's fantastic. It's efficient, accurate, secure, so on and so forth. I've listed the advantages. I can't imagine going back to a piece of paper that I hand to the patient to get lost or forged on the way to the pharmacy. However, there are many challenges to dermatology and teledermatology relating to disparities in healthcare and the digital divide, to dermatologists, patients, organizations, and the misinformation out there. So let's hope that we can show that it's available more widely and at less expense, but it isn't always suitable. Imaging and smart devices are improving steadily. So I had a look on the AI store on my iPhone to see what I could find to take a photograph of a skin lesion, which turned out to be my cat. So Flossie kindly stood still for long enough for me to take pictures using various devices. So the first one took a very nice photo. The second one said I could try it for free. The third one told me I needed better lighting. Image archiving remains a problem to people all over the world. Numerous dermatologists encounter difficulties in archiving in images and then in finding them, in finding time to label them or diagnose them. We use Waba Medical Pics at Waikato Hospital, which is a British solution. So I pick up my phone, use the WMP app, log on, take some photos, add the patient information and click go. And when I click go, it appears in the patient's record instantly, so that immediately I've taken the photographs, I can share it with the patient on the screen and demonstrate that even though they thought their skin condition hadn't improved, when we compare with last time's photographs, there's been a tremendous change. So image in radiology use DICOM standard, and this is rarely used in dermatology, despite the fact that a dermatological variant of DICOM has been around for a few years. It requires time to tag and organize it. There are improving systems, but if you are using DICOM, be aware that you shouldn't just pick up your image and use it for education, because it does carry identifiable material that you'll need to strip off. Dermoscopy enhancement. How did that happen? Tremendous. Let's look at these pictures I've shown. So I had a patient with scabies in front of me. I took some standard photographs, some dermoscopy pictures, and then I took fluorescent pictures. And this is available on your DL5, a derm light. And it shows that the scabies body is visible as well as its head. So we've been looking at the head of the scabies mite for the last 15 years or so, but now we can see its body in fluorescent green. Well worth trying. So AI-driven analysis is available. Photos Finder has the scheme device. We have AI-assisted capture with working models such as AIP Derm available now. Total body photography is coming to a room near you. However, we must have excellent quality, consistency, and representative images if we're going to be able to see change over time. The current devices vary from extremely expensive and quite remarkable to not so expensive and a work in progress. But we can hope them help. They're going to help us make a diagnosis and detect change in patients where change is the way to diagnose their melanomas. There are many other enhancements, and these will appear on point-of-care devices, getting cheaper, smaller, easier to use, increasingly accurate as time goes on. I've listed some of the available systems that we haven't got time to talk about here. So I looked at the App Store to see what I could find and discovered that AI could simulate aging. I was too scared to see what I was going to look like in 30 years. I guess it's a skeleton in a coffin or a bundle of ash. My registrar, soon to be consultant, Geetka Seth, came back from the United States with something we don't have available in New Zealand, the Ray-Ban Meta smart glasses. And she walks around taking photographs of everything, including me in our workroom. However, we decided between us that the quality of the Ray-Ban Meta smart glasses is not yet up to clinical expertise. As she takes a photo, the glasses just flash. So watch out, if you see flashing sunglasses, you are on display to the world. Take care. Or you could buy a virtual reality headsets. Now, these were originally invented for gaming, but have become increasingly sophisticated and can be used in medical education, diagnostics, treatment, and patient engagement. I asked ChatGPT what I might use one of these Vision Pro glasses for, and it came up with all sorts of ideas listed here. And I also found some educational references showing how virtual reality can help in teaching dermatology to students and residents. Is this the future of teledermatology? Will we have holographic patients in our teledermatology live consultations? And will they be able to, at a distance, show us the moles that are changing? I asked Cici, that's Apple's active AI, to tell me about this photograph just randomly picked from my desktop. And it quite accurately said it's a mole on someone's skin. It's round and brown with a darker center. The surrounding skin is pale with a few hairs. The image is likely taken with a dermatoscope. So that's pretty accurate. You can use LLMs for wound measurement. And there are a number of smartphone apps that will do that for you. And you can size a wound. I didn't have a wound in the day, but so I used it to size a scar. You can generate new images from old ones. So here's me in an oil painting, a photographic style painting, and ink wash. But watch out for deep fakes. So deep fakes abound because the media can be digitally manipulated, including images, videos, and audio, to inaccurately represent real people. I haven't found anything published about any deep fakes in dermatology, but watch out. You too could be subjected to this, as a number of doctors have been caught in deep fake deceptions, including in New Zealand, to promote products of dubious benefit. Fake images turn out to be easy to create. For free or a few dollars, the App Store will produce several different apps that you can use to produce your own deep fakes. Photo editing. I downloaded something called Facetune and fiddled about to see what it would do. And it makes me look, I don't know, younger. Do I want to look younger? I'm not sure. I'm proud of my wrinkles. I've been growing them for a very long time. What about diagnostics? So AI diagnostics are here to stay and are rapidly improving. People are scared of these. They're scared of losing their jobs, but we should be embracing the tools to help us do our job better. Machine learning diagnostic systems are incredibly fast and accurate, but they do include false and positives and false negatives. But are humans perfect? So machine learning applications can result in risk stratification, disease prediction, triage, prescribing, patient engagement, diagnosis, image analysis for skin cancers and inflammatory diseases, measurements using close-up or dermoscopy images. They can be used for cosmetic dermatology, for Mohs surgery, and of course, research. Direct-to-consumer mobile apps are very popular, but notice how if you download them today and then try again in a year's time, most of them have disappeared and only a few will stand the test of time. These are very inexpensive and educational. They offer archiving of photographs and may observe change in moles over time. Many nowadays include AI tools, and the algorithms are improving. But do they work? Are they transparent? Are they consistent? They send a lot of patients to primary care, and the primary care listens to the patients who say, machine says, and become nervous, and that results in increased referrals and excisions. So what about this one? I thought I'd look at whether I could use any of these mobile apps for free. The first one said the photograph of my daughter's wasp sting was not suitable. The second one said it was a wart. The third one said pay $79. And the fourth one said, hold tight, we're getting ready. And I waited. So they're a work in progress too. The cosmetic companies are beginning to produce their own AI-assisted apps. And it's interesting to see what's available out there. So diagnostic AI is taking off. It's already used in radiology and will increasingly be used in dermatology. But to do that, we need our patients to be digitally competent, and we must ensure that oversight by humans is occurring. We need local data for algorithm validation, and we mustn't forget to include all skin colors and diseases. The challenges for AI are huge to the dermatologist, the patient, to organizations, and misinformation continues to cause us grief. And expensive is a problem to national health systems. We love the large language models. Can you think back? Only 2 years ago, we were just beginning to hear about ChatGPT, and now it's in our pocket and used many times a day. Chatbox for education, virtual health, preliminary clinical assessments, skincare, and chat with an AI consultant. Don't forget to take your pills. They're due at 4 o'clock. We can use them for AI presentation tools. I asked a particular system called beautiful.ai to prepare my next presentation. And in a few seconds, it came up with quite a good presentation on my behalf. It does need a little work. And of course, we know about Audible scribes. How many of you are using an Audible scribe for your practice? We've got a handful of hands going up, but in 5 years' time, I think all of you will embrace these wonderful, wonderful things. With minimal training and multiple languages, we can save time, reduce burnout, improve our notes, and the patients are happy. So Tuhi is the one that I'm offered. It's beta, so it doesn't always work, by Health New Zealand. It takes me a few seconds to ask consent, and so far no one's refused. I press go, I conduct my consultation, I stop recording, I review on the web page, and I copy and paste into my patient notes. And this is what it looks like. It's all readable, no spelling mistakes, logically assumed, and misses out the cracks. my time's up, but luckily we're a bit ahead of time. Technology is exciting. AI is here to stay. The future of digital health in dermatology is challenging regarding confidentiality, safety and precision, dermatology challenges. But on the other hand, the diagnostics are improving and skin imaging is absolutely fantastic. We do need large data sets. It uses a lot of energy. And just imagine this, your clinic room in the future. That is going to allow you to listen and talk to the patient rather than staring at a computer screen. I forgot to tell you about some of these things. Perhaps Joe will cover them. Thank you for listening. Embrace the future. It's coming soon.